Hello, we're here today with Dr. Kate Philippi. Kate, can you tell us what you do here in Chicago and how this story began, this health story?
Yeah, so I'm a licensed acupuncturist and herbalist, and I practice at Align Modern Health in Chicago. My journey started very personally when I was living in Ohio. I had just graduated from college and was working in fashion merchandising, which was exhilarating, but what I found to be very stressful and unfulfilling. So I left that job after working there for almost a year, and had always kind of been interested in more alternative complementary medicine. I had considered doing naturopathy, and so I left, and I just kind of tried to find what resonated with me. So while I was working in the fashion industry, it's a pretty toxic environment, and I had stopped getting regular menstrual cycles. And my mom was having acupuncture at the time, and she suggested that I try acupuncture. I've never been one for needles, and so I was pretty hesitant, but I went with her to one of her treatments and really connected with her acupuncturist. He was very spiritual and was intuitive, and I really liked that aspect. And I saw that my mom was able to tolerate it just fine. The needles weren't terribly uncomfortable. So I set up an appointment, and I was hooked after the very first treatment. I had never been connected to my body in that way. The actual like insertion of the needles just felt things internally that I had never felt before. And so I saw him consistently for about 3 months. I was doing acupuncture once a week, and I was doing herbs, and my cycles returned after the first 6 weeks or so, and they've been consistent ever since. And I decided this is what I want to do the rest of my life. So I decided to leave Ohio. I just wanted a change of scenery. I'd grown up there my entire life. My entire family was there. I just felt like I needed physical space to kind of find out what this journey was going to be like for me. So he wrote down on a post-it note the Pacific College of Oriental Medicine. And he said, when you get out to San Diego, check out this school and see what you think. So I took a full-time live-in nanny job. So I had a place to go. I had a family out there. And the first week, I kind of let myself settle in. And then I called the school. I went in for an interview, um, really felt at home, and I submitted my application, and I started the semester 2 weeks after that. So it all happened very quickly, but gosh, it just has been the most incredible journey since walking in the doors of that school like 15 years ago.
So that's a really nice story, and it's so comfortable, really, how it happened. It feels very at ease the way and in flow.
Yes. Yeah. When, I often get this question from patients in clinic, like, how did you start doing acupuncture? How did you come to be an acupuncturist? And, I always tell them I feel like it happened to me. Um, I don't feel like I took a like super active role until it just like became what I was supposed to do. And I just didn't, there was no other option. It just kind of felt like that was everything that I wanted in life. And to this day, my relationship with patients and just the practicing the medicine itself is really gives me a lot of life. And I learn more about myself as I continue to learn more about medicine and practice. So you know, I get back what I give. It's such an energetic connection with the medicine, with patients, with everything. I can't imagine doing anything else.
So I just want to go back to your mother. So your mother um, was very open-minded then about all of this. How was she like that? Was that from her family, or had she gone on a discovery journey herself?
Yeah, so she um, came from not really having experience with any of this herself. She kind of went through, and these are the words that she would choose, a little bit of like a midlife crisis, and had realized like she wasn't actually living her life. She had 3 young kids. She's a stay-at-home mom. That was always what she had wanted to do, but she still, there was something that was missing. And so kind of in her journey of self-discovery, had connected with these different souls and people that she'd met along the way, from intuitive people, Reiki masters, acupuncturists, naturopathic doctors. And so she just more and more felt connected to that aspect versus more mainstream medicine or mainstream ways of healing. So it was kind of, I feel like, brought on for her through this kind of like awakening that happened on her own. So it was pretty cool.
It's quite amazing that she was already in that world. And
Yes.
when was that? The 80s, I suppose.
Yeah. So I was she was around, she was 40. So was like the mid 90s.
Oh, the mid 90s. Okay. So,
Yeah.
so she laid this foundation in a way, modeled behavior and got you to see this alternative approach. So going back to you now, so this life sort of presented itself to you and it just felt comfortable, and then you rode into this world. And it affected your health really quickly, which is very impressive. So when you're working with clients, are there particular areas that you're working on consistently that people are coming in with, particular problems and issues that you're helping them resolve?
Yeah. So, and I feel like this kind of goes back to how I got into it myself. So I do see a lot of reproductive health conditions. I've kind of, it's kind of come to me, and I have a particular interest and passion in fertility. So, males, females, all of the above. And I really like to talk about the mental emotional aspect that fertility has on these patients. We work a lot with an infertility clinic here in Chicago. So I work alongside, reproductive endocrinologists and nurses and nurse practitioners. So very, kind of traditional mainstream medicine. And so I like to blend and bring more of that, Eastern, um, acknowledging the aspect of the spirit that, is often overlooked in these stressful, taxing treatments that these patients are going through. And we work on, during when they're on the table, obviously they're getting acupuncture and the needles, but we do a lot of talking about, mind-body connection, doing meditations, connecting with massage. I really support, uterine massage, putting your hands on your own body. So kind of working more with the mental emotional aspect of fertility has been really, really cool to see.
And is the fertility center, are they sending the people to you? Are they recommending that they go to you to complement what they're doing?
They do, yeah. So that's probably my biggest referral source outside of, my own patients sending their, friends and family. The next would be, yeah, the fertility clinic, so reproductive endocrinologists, and then also OBGYNs will send pregnant patients as well.
And what will they say to them? I mean, when those patients come to you, what are they leaving with? Is there something specific that's happening to them? So this is for people who've never tried acupuncture and don't really know what it's about. I'd like them to know more when they listen to this conversation, because I think it's really important.
Yeah. So yes, I, often talk to the patients about, reconnecting with their body. Oh, sorry, hang on. Somebody's knocking at my door. Hang on. Sorry.
Well, you're at work. It's fine. You're in a
I
busy.
know.
There you are.
Busy, busy all day.
You're giving me a moment of your precious time, and I'm
Sorry about that.
okay.
Yeah, so I feel like, when they leave their doctor's office, they often feel like they aren't heard. They have a lot of questions, or, maybe the questions don't come in that like 10 minutes that they have with their doctor. And they're like, wait, now I'm gone and I have all these questions. So that's the aspect that I feel like I can provide is I give them that time and that energy to sit down and like think about the questions. We talk through things. If their doctor's suggesting this procedure, they want to know, okay, pros, cons, what information is it going to give? Like, how is this going to influence my treatment? So what do you think I should do? I get a lot of like, what do you think? What's your experience? Unfortunately, I feel like a lot of times they don't get that connection with their doctors. They often feel disempowered. And I am really trying to empower them to be their own best advocate, to ask questions, and be a resource. It's unfortunate the way the current medical establishment is set up in a lot of ways. It can be, really frustrating for patients. So I feel like that's something, that we provide here, in our treatments is just like full access, like ask me questions, let's talk about things and brainstorm. And I empower them to go back to their doctor and ask, I'm not really sure that I want to go this route. Can you tell me a little bit more about it? Can you give me other options? And so that always feels really good.
And also, I want to get into the actual acupuncture because I know you're making them feel safe and helping them. But what about physically? What's happening when you're working on any client? Especially if they've got hormone or fertility issues, because I know that's your interest. But
Yeah.
what do you do if they come in? Are there certain areas where you put the needles? Do they get an immediate sense of relief? What's happening with that?
Yeah, so it can be hard with fertility or menstrual cycle related things because sometimes there isn't something tangible, right? So if our goal is to help a patient get pregnant, that's the goal. But that might be months, maybe a year away if it happens. Um, so I really like to kind of talk to them about other little ways that they can see that acupuncture is working or helping them to feel better, kind of optimizing their health. So, for example, like I have a patient right now who is getting ready for an embryo transfer, and she has some history of sexual trauma. She has had multiple failed embryo transfers. Her uterine lining is typically very thin. It doesn't respond to many medications. She also has a lot of immune dysregulation. She has this like disconnect from her uterus. She thinks her uterus is bad. She thinks it's not hospitable. And so we have really been working on talking positively and thinking positively about the uterus and visualizing this nutrient rich blood flow into her uterus as it's preparing for this embryo transfer. So I actually saw her this morning. I put a couple needles in. They weren't even near her abdomen. I was working on the lower leg and the foot. And she said, whoa. And she's pretty needle sensitive anyway. So I kind of paused for a second. We usually will do some deep breathing. Said, you doing okay? And she said, I feel like I'm getting my period. Like I feel like my uterus is cramping. And I said, okay, all right, that's good. And usually she has like no sensation in her lower abdomen. So for her to have that feeling, to just be aware and like just be paying attention, honestly, just be paying attention to her lower abdomen, her uterus was a huge, huge shift for her. There were some tears, which is good. I feel like it's good to get that out, kind of process. So that's been quite a journey with her, and we've only been working together for 6 weeks, and I've seen her once a week for the past 6 weeks. So that's pretty amazing. So I'm really hopeful for her embryo transfer next week.
So I'm thinking about that, and it reminds me, I'm just going to bring in a little story of when I did some healing on someone, and it's just, these are all energetic systems. It's, a system of energy doing the acupuncture, the healing, all these different systems. And it was very strange. She had, when I worked on her, this space, her torso area, felt completely empty. It was as if I could put my arms straight through and there was nothing there. And I said to her, I said to her straight away, I said, oh, and she hadn't said anything. I said, do you have a digestive problem, a problem with food? And she said, yes. She said, I eat and eat, but I can't feel the food. And I thought, that's because you've disappeared. Something energetically had disappeared. So it suddenly reminded me of that with this, because she had her own trauma. So we worked a lot on her actually, having her hand on her tummy and just reconnecting to her body, because it's almost like she disassociated. So I think when you're talking to me about this woman, she'd had these traumas around this area, and it's almost again as if she just disconnected from that space. It became an ugly space, an unsafe space, an inhospitable space. And just the fact that she finally felt something is the beginning of healing, because people can switch off from parts of their bodies. It's really
Oh
interesting.
yeah, absolutely. I feel like I see it a lot, digestive stuff, reproductive health, also pain. I feel like most people are in pain, to some degree. There's something chronic or acute. And especially with chronic pain, there's just this dissociation, right? Because the nervous system I still have to function, right? I still have to go to work. I still have to take care of my responsibilities. And so in order to do this, the body thinks like, oh, well, I just have to like kind of cut it off, right? Pretend it's not there. So it's really, and I see that a lot with fertility because they feel broken in some way or another, and it's really unfortunate and sad. And so I feel like helping that connection happen again, is really important. And I see once that connection starts to happen, like really rapid changes, whether it's a uterus for transfer, or if I have patients with diminished ovarian reserve where their ovaries are not responding or poorly responding to treatment. And then there's this connection that happens and they start responding better, or the quality of the eggs is better and they get good embryos, whatever it is. It's that connection is really important.
So can you speak about how acupuncture works as this energetic system? Just a little brief outline.
Yeah. So I tend to describe it a little bit more using more like Western terms, as it just kind of helps people associate a little bit better because we're kind of familiar with it. So acupuncture kind of works in two ways: regulating blood flow, promoting circulation, and also in regulating the nervous system. So blood carries everything that the body needs to heal. It has all the nutrients from the food that we eat, supplements we take, the body's natural painkillers, carries the hormones. So it helps your body to utilize the hormones more efficiently and effectively. And then with the nervous system, when you're feeling stressed out, you're feeling anxious, that's that fight or flight response. And acupuncture turns that off and puts your body into a rest and relaxed state. So that has a host of good benefits: decreases inflammation, regulates digestion, balances mood, balances energy. All of the good things in our body come when we are out of that fight or flight response. So that's kind of how I found most people can really grasp the concepts of Chinese medicine.
That's perfect. And in my head, I keep thinking about people with depression. Do you see many people who've got sort of anxiety or depression? So I know that's really kicked off in the last few years when people have felt very isolated. Are you helping people like that?
Oh, for sure. Yeah. A lot of anxiety and depression. And I think we're just hitting the tip of the iceberg. I think a lot of people they are still working from home, they still aren't out connecting as much as they were, even though, things may be getting, more back to normal. Yeah, I'm seeing more and more people on antidepressants or anti-anxiety medications. And it's very common. So I definitely talk a lot about, again, I kind of feel like it comes back to reconnecting, right? Like, let's try to find out what happened when you started to feel this way. Did something happen? Is there something that you wish you were doing that you aren't doing now? And really kind of helping them to make some moves in a direction that more aligns with who they are, physically, mentally, emotionally, spiritually, whatever that is, because it can manifest so differently for different people. So when people do come in with depression or anxiety, I'm always asking for specifics. I say, how does it manifest for you in your body? What does it feel like for you? And then that really helps me kind of tailor my treatment, and then also kind of help with conversation.
And do you find that has a positive impact on them healing from these issues?
For sure. Yeah. Oftentimes they are also seeing a therapist. I don't pretend to be a therapist, but I do think kind of talking first and then doing the needling, that act of like connecting the physical with the mental, emotional, spiritual side of the actual needling, that connection that happens is really helpful. I've actually seen quite frequently where patients who are taking medications almost become too strong for them. Like they feel like, oh, wow, I don't like the way I feel. And so they often have to go back to their doctor and decrease their medication.
That's really
So,
good. Thank
yeah.
God for that.
Yeah.
So on a really personal level, what's it like being, in service to others? Because effectively that's what you are.
Yes, and I think that that very much aligns with my being. I wanted to help people. That's why I left the fashion industry. I was sitting in this meeting, and I was a buyer, and so this buyer who bought graphic tees for little girls was so distraught that this shirt that he bought so much of, that these girls weren't buying. And I just remembered thinking to myself, I can't care this much. I need to do something that like makes a difference for people, and this is not it for me. So I made a very conscious decision to leave. Um, and yeah, I feel like that's my calling. I want to help people. I want to take care of people. I want to help them live the happiest and healthiest lives that they can. It can be hard, not everybody is ready to do that, and that's okay. Everybody's on their own journey, but it is an absolute pleasure to be witness to the many many healing journeys that I've seen, and hopefully will see in the future. It's been pretty amazing.
So when have you seen it where, suddenly, they are getting their period again, their menstrual cycle's back, or suddenly they can get pregnant? Have you witnessed these things, or as you say, they're coming off their antidepressants? Have you, seen these shifts in their health?
Yeah, for sure. I think, I always tell my patients, right, again, if the outcome is, ideally a healthy baby at the end of everything, there are little shifts we see before then, like a more regular menstrual cycle if they're irregular, maybe a period that is not painful, if they have to take off work on the first day of their period, all of a sudden maybe they're able to work, or they don't have as much pain, or their premenstrual symptoms get a lot better, and their quality of life improves. Their energy is better. They want to connect with other people. They want to connect with nature. This like, kind of feeling that you are more like yourself. You just know yourself and how it feels in your body. I had a patient, this has been a number of years ago, I guess maybe almost 10 years ago now. I was working in downtown Chicago at a clinic, and he was an older gentleman, and he was a lawyer, and he would come in on his like lunch hour. And he kind of, I think he wanted to kind of use it as a nap, to be honest. And so he would come in and he wasn't like always super connected or like, but I would still ask him questions. I'm like, okay, how are you doing? What was, how's your stress level? How have your migraines been? Whatever. I was trying to like be the best acupuncturist I could be. And he was, usually a little resistant to my questions, just wanted to get on the table. So after working together for a couple months, he comes in and he's like, you know what? I just thought about it, but I haven't had a migraine since I've been coming here. And I was like, oh, that's great. So everybody's on their own, journey. And then I feel like kind of after that time when he realized like, oh, wait, I haven't had any migraines. Then all of a sudden he was like, he would talk to me and he would answer the questions and, we kind of could engage and connect a little bit more. So, everybody's different and we all have different, journeys of healing, different paths that we're on. And it's honestly, it's fun to be witness and to join people for even a little bit of time on their journeys.
So I'm going to say something on a personal level for me, because I come to you at Aligned, and because I've done acupuncture for quite a few years now, and it's made a profound difference to me, feeling, calmer. And I come in and I do have a good rest, and it just switches me off when I've been very anxious with my own healing that I'm on, my own healing journey. But it was extraordinary. The other day you were working on something for me, and it was literally like a massive electric shock when you put some needles in. So you really feel things connecting, and I thought I was going to leap off the table. It was so strong. And sometimes you might be putting it in my toe and my whole leg goes whoom like that and pings. So what's happening in that moment where it's so distinct, that feeling?
Yeah. So I kind of describe the acupuncture points as either areas where a lot of nerves or a lot of blood vessels are. And so that potential for energy is greater in those areas than at other parts in the body. So you access one part of the body, we're all connected, right? You can't disconnect us. Everything kind of works together. So like that patient I was talking about earlier, I was doing some points on her legs and feet, and then she felt it in her uterus. So those channels and that blood flow and those nerves that are on the extremities can affect different areas in the abdomen, which is really nice because then, if for some reason you can't directly needle the abdomen or don't want to, or whatever the reason, I always have other options. I have so many points to choose from on the body, and so many different ways of getting at it, right? Like it's very much an art. So, I don't ever feel like, oh, they have shoulder pain on the left side, so I need to needle these 4 points. I like that gray. I like being able to adapt and kind of choose and do what's fitting for that patient that day.
Perfect. And just hearing you, something really struck me when you were speaking is when we go to, strict Western medicine doctors, is that called allopathic? How do you call it?
Yeah, allopathic.
Allopathic, that's right. Allopathic medicine style. It's almost like they treat the symptom and it's very specific. So it's as if your body is just divided into parts when you see a doctor, a strict, straight doctor. And when I talk to you, it's a complete organism. It's the body is, everything is working in tandem and everything is working together. So you put a needle in one place, you fit it somewhere else. And you're working with the whole system to get it into balance from what I'm hearing, rather than, okay, my fingers hurt, I'm only going to treat that. They're so specific. It's as if they're missing the whole story. They're only getting one part of the story.
Absolutely. Yeah, I have patients that come in and they're like, I went to see my doctor and I have this, digestive complaint, right? I have constipation. They didn't even like palpate. They didn't even like touch my body and like assess what was going on. And it's really fascinating to me how you can just sit in a room and just hear somebody, talk and feel like you don't need to ask more questions or like, oh, you're constipated. Okay, well, let's figure this out. Like, are you drinking enough water? Do you eat vegetables? Like these kinds of things, right? Like, oh, well, I'll just give you a prescription for this medication. And maybe they do need a prescription, but if we just maybe took some time to assess what they were doing, is there another modification that can be made that might be more lasting, more helpful for them, and maybe potentially not cause some other issues? So, it's just a very different way of looking at the body for sure. The human, right? So not just the physical body.
Very different. And I just in my head, I kept hearing it's the doctor is all about symptom management. Whereas when someone comes to you, you're diving into their thoughts, the way they interact with life, their history, their intentions, their goals. You're looking at the whole system of who they are, including the sort of spiritual beliefs and just everything about them, because all of those things can be impacting them, including, like you said, with the lady with fertility issues, you said something sexual has happened to her. She had some sort of abuse.
Sexual trauma.
Sexual trauma. So that was having a massive impact. So it just doesn't make sense to me that to go to get help only for a symptom. It just is very short-sighted. I mean, it doesn't mean that, if I've got a really bad headache, I'm going to take a painkiller because it's great and it gets through that bump. But then if it keeps happening, I've got to look at, is it coffee? Am I eating sugar? Is there something I'm really stressed about? Things like that. You've got to keep just going back to see what the story is behind the symptom. Anyway, I'm going to round this off with a question, a general question. I've been asking this to quite a few people in the show, is what would you like to see more of in this world? If you could wave a magic wand and it would actually happen.
I think awareness. I think people being aware of themselves and, what their needs and wants and their feelings, and how their physical body feels, and that awareness then of other people. I think so many people are just kind of walking around, almost a little bit on autopilot. And so it would be really cool to see more awareness and intentionality.
Perfect answer. I agree. Yes.
Yes.
Thank you very much for a really lovely interview.
Oh, thank you. It was my pleasure.